As an assistant, positioning the high volume evacuator during a procedure will help keep the field of vision clear. There are several different handholds that we use when we're talking about the high volume evacuation. One being the pen grasp, the other being the thumb to nose grasp. The thumb to nose grasp is often used when retracting the tongue or the left side of the cheek. We're going to be going through different positions in the mouth with the high volume evacuator based on where we're working in the mouth. When we're working in the mouth, we want to remember to wear all of our PPE. And anytime the handpiece is running, we want to have the high volume evacuator on and in position. It's important to be in position prior to the dentist starting the preparation. One thing you'll be doing with the high volume evacuator is also retracting cheeks and tongue. As an assistant, it is very important in the retraction that you keep the cheek and the tongue out of the high-speed handpiece. We will now show you some different positions. As we're preparing on the lower, if we're preparing a premolar, we want to have the high-speed evacuation tip, the bevel, in relation to the arch. Also, you want it to be slightly higher than the occlusal edge of the tooth. If we're working in the anterior region and the dentist is preparing from the facial area, your high-speed evacuator should be on the lingual surface of the tooth. Also, if we're working on the left side, you will be retracting the cheek, and the doctor is usually retracting the tongue with the mirror. Again, the bevel being in line with the arch and slightly higher than the occlusal edge. Also, if you're working on the right-hand side with a right-handed operator, you are responsible for retracting the tongue. This can be done with the high-speed evacuator, and you may need to assist also by using a mirror. We'll now move to the upper arch and show you some positioning there. Positioning on the right, again, the bevel of the evacuator tip is in line with the arch and slightly higher as we're preparing an occlusal surface. If the dentist is preparing on the facial surface, also your evacuator tip would be in the same position. If we're working in the facial surface of the anterior region, the evacuator tip bevel will be on the lingual just as it was on the lower. If we're working in an opposite position on the anterior, on the lingual, your high-speed evacuator will be on the facial, also retracting the lip and suctioning at the same time. When we're working on the left side, you will need to retract the cheek as the dentist is working on the occlusal surface. This holds true if he's working on the lingual surface. The most difficult area to retract and suction is if the dentist is working on the buccal of the upper left. If the dentist is working in this area, a lot of times the patient's head will be turned to their right or toward the operator, which makes it difficult for your positioning. A lot of times your positioning will need to be all the way in the posterior of the mouth to catch the water as it runs to the distal area. Anytime that you're evacuating during the procedure, it is important to always keep an eye on the back of the throat of the patient. Even though you may be evacuating in the area of the field of vision, you will have excess water and saliva that builds in the posterior area of the mouth. A lot of times it's important to position in each corner to remove any excess water. One thing that you'd never want to do is to take the evacuator tip and put it straight down in the center of the throat. This can actually activate the gag reflex if you accidentally touch the soft palate of the patient. Always position in the corners. Another important aspect of evacuation is never place the tip against the soft tissue. Pressing against the soft tissue on the alveolar ridge or against the cheek can cause injury. If you need a fulcrum with the evacuator, you may want to use your other hand to rest against. Anytime you press against the palate or against the alveolar ridge, you can actually make that injury. Also, it is important that the assistant pay attention to the patient, not just the field of vision. It is your responsibility to pay attention to the patient's eyes and their body language. A lot of times patients can feel very claustrophobic with the amount of water that can build up in their mouth. So as an assistant, it is important that you ask periodically if the patient is doing fine. If you see any anxiety within their eyes or in their hands, you may want to ask the question, and a lot of times that will trigger the dentist